Good afternoon, Dr. UDAI, Senior Physician at Amur Hospital, Department of Internal Medicine, and today we will just briefly discuss on the post-COVID complications that we encounter. Basically, post-COVID can be divided into acute COVID illness that generally lasts for about 4 weeks. If the symptoms persist for more than 4 weeks, between 4 to 12 weeks, then we call it acute post-COVID illness. And if the symptoms are more than 12 weeks, then it's called as long COVID illness, long COVID syndrome. And if some of these symptoms do tend to persist for more than 24 weeks, then we call it persistent post-COVID illness. Now, these symptoms can vary from in any patient, whether the patient has been admitted in hospital or has had a mild disease. The disease can affect various systems, right from the cardiovascular to the respiratory system, as well as you can have it affecting the skin, the eyes, the gastrointestinal system, and so forth. Well, some of the most common symptoms that we encounter post-COVID are people have extreme weakness, lethargy, malaise, they have body pains, and in addition to that, they have some difficulty in concentration, what we call as brain fog, cognitive impairment, and difficulty in concentrating. These are some of the more common neurological problems that one can encounter. Shortness of breath, chest pain, these are again some common symptoms which one has to be careful about and need to see your doctor if you have these symptoms persisting over a period of time. In addition to these common symptoms, sometimes we have seen in some patients, they develop, patients who are not diabetics, their sugars tend to go up, so you need to monitor your blood sugar. Some patients tend to have a sudden impairment in their thyroid profile. So if you have any symptoms of continuous fatigue, weight gain, breathlessness, you should see your doctor and take the appropriate measures. And even if somebody is having chest pain, we have seen that some of these patients are more prone to blood clots that can form in the legs, as well as these can go up into the pulmonary artery, what we call as pulmonary thromboembolism. So please do not neglect any of these symptoms that one may have persistent after post-COVID, and you should take care. Some of the less common problems that they can have is skin manifestations, like you can have rashes on the body or chilblains on the skin, and dryness of the eye, blurring of vision. These are some of the other common problems that somebody can encounter post-COVID. In addition to gastrointestinal symptoms, persistent bowel movements can be frequent, may not be loose motions, but increased bowel frequency, some gastrointestinal disturbances, these can be there. And some people also have altered liver function tests for some time, what we call as altered transaminases. So these need to be kept in mind. So if you have any of these symptoms persisting after recovering from COVID, please consult your doctor and make sure that you are seen immediately. Another thing that we have seen quite frequently is some of these patients tend to have a lot of depression, and they have difficulty in getting back to work, and so they even may need help in terms of taking antidepressant tablets, and need good physical rehabilitation, physiotherapy, especially people who have difficulty in breathing. So these are some important things that one must keep in mind post-COVID. And I think that is why we at our hospital are encouraging post-COVID clinics, so people to come to, if they have any problems, so that we can help them out. And we have a good physiotherapy team and a rehab team that helps some of the patients who may need help in these matters. So follow-up post-COVID clinics, I think, are very important. People should be aware of this because, COVID illness, everybody may not have these problems, but some people who have it and they persist for very long, it can have a very dreadful impact on their daily life. So to prevent any further complications, and you should see a doctor at the earliest. So these are some of the things I would just like to highlight and bring to one's notice. And if we can be of any help at any time, please let us know.
What kind of care must be taken by the cardiac patients?
I mean, somebody who's already has a cardiac issue, he should have a regular follow-up. Post-COVID, there is a possibility that they can have what we call a chance of having a heart attack, myocardial infarction, or there's something called myocarditis. Somebody having chest pain, they have to be careful. Alternatively, as I said about embolism, these people are prone to ischemic injuries. So I would say that anybody who's already a cardiac patient should be on a regular follow-up with their cardiologist or their doctor on a frequent basis. Okay?
That's
right.
So any kind of food restrictions we should have, sir?
I mean, food restrictions, not in particularly with respect to COVID, but suppose somebody post-COVID has developed, say, high sugar. So obviously you need to make sure that you take less sugars, or cut out the sweets and sugars in your daily intake of meals, and see a doctor to see that the person has not developed new onset diabetes, because some of these patients could be on steroids at the time of COVID, which is one of the drugs that can cause the sugars to go up, and some people, even after stopping it, can tend to develop diabetes. So you need to be careful about with respect to that. And otherwise, food, other things, if somebody has got already a history of cholesterol, high cholesterol, obviously you need to be careful of what kind of food you eat. Avoid oily foods and foods which are high in fat content. I would advise people to avoid alcohol if they tend to take that. Obviously, smoking is an absolute no post-COVID, and because some of the respiratory problems that we have seen is that some people develop fibrosis post-COVID, that is, the lung gets very weakened and is not able to do its function normally. So these are some of the precautions one should take. So particularly with respect to food, there is no thing that you would say that, but if these, the above mentioned problems that I have said, if those are there, then we need to take these precautions. And if somebody is in a habit of doing regular exercise, don't go back to your immediately starting to exercise. Do a graded thing, like gradual walking, and step it up only over a period of 2 weeks or so after one starts recovering. And what I'm trying to say is, don't get into a very hectic activity straight away. And I would advise people who had COVID during the illness also and post thing to take a good amount of fluids. That helps in the long way in preventing some of the complications. So hydration is very important.
So what kind of measures children should take it once they met with the COVID?
What? Sorry?
What kind of measures children should take it?
I don't think I'm the right person to answer that. I'm not a pediatrician, so I would not like to transgress into somebody else's. I'm not an expert of children, so I would defer to talk on that. But I don't think the treatment will be very different for them too. So I think a pediatrician is the right person to answer that.
Yeah. So anything on skin care or the hair loss that we see after the COVID treatment, sir?
Yes, sir. So as I mentioned, hair loss is one of the things that can happen. So that happens sometimes in patients who develop some thyroid impairment. So you should get your thyroid evaluated, and see if that is normal. Then obviously there can be other causes also. So you may have to see a dermatologist. But one of the commonest problems that we have seen is people who have developed hypothyroidism. They develop some amount of hair loss that can take place post-COVID. Those patients may not necessarily have been thyroid patients, but these are some of the symptoms that we've seen in people with post-COVID, especially long COVID problems.
So what kind of particular health checkups the patient should go on, sir?
No, as I mentioned, particular health checkups in the sense that be in touch with your doctor regularly. If you have any symptoms or any difficulties, get in touch with them. Don't ignore them, and your doctor will then evaluate you and then provide you with what are the relevant investigations. You don't need to go and do a host of blood tests on your own. I would suggest that you meet your doctor, because I see that a lot of patients tend to hear from their relatives, friends, and do a series of high costing investigations, for example, like D-dimer, interleukin 6. All those things are not really necessary, especially in post-COVID. My advice would be that if anybody has any symptoms which are persisting and you think that they are related to your COVID, please meet your doctor, let your doctor evaluate you, and he will do the relevant investigations that are required.
So how authenticate suggestions we have on internet and YouTube, sir? So patient should follow or should consult the doctor?
See, in this age of hive of technical advances, everybody tends to go to Google and YouTube. I don't think that's the right thing. I personally think that you should meet your doctor, let him evaluate you. You may miss a few things, or you may think something which is not very relevant. You may take it very seriously and think that you have some major problem. I do not believe that YouTube and all are something that you can of course you can go and see some things on YouTube, or some expert doctors are there who are advising. You could hear them, but I would still say that you meet your own doctor and get your clarifications done.
Yeah. Thank you, sir. Thank you for information.